Be vitiated.
Without objection.
Thank you very much. Madam Chair, before I begin, I want to take a moment to pause and remember an effective leader in the labor movement and a real champion for working families, Richard Trumka. Richard Trumka believed in the dignity of work, and he also believed in the dignity of workers, and that they should share in the prosperity that they provide for others. His family is in my prayers, and as we remember and honor his legacy as a vital leader in the labor movement and the larger quest to make us a more just society, providing opportunity for all of us. Madam President, I am back on the floor of the Senate because I believe that health care is a human right. And it is certainly something that the richest nation on the planet can afford to provide for all of its citizens. I've come to the Senate floor with the same message week after week because I think it's vital and important. And with all of the incentives on the table for my home state of Georgia to expand Medicaid, it is past time for Georgia and the other 11 non-expansion states to finally expand Medicaid. My home state of Georgia has the opportunity to provide affordable health care to 646,000 people who could qualify. But instead of allowing Georgians to continue to suffer and be cut off from care, while politicians are playing games, I introduced the Medicaid Saves Lives Act. This is legislation that would provide people in states like mine who have not expanded Medicaid an alternative path to health coverage. In the richest country in the world in 2021, and amid a once-in-a-century pandemic that has both illuminated and exacerbated the consequences of long-standing disparities in health care, too many Georgians are still struggling to get what they deserve and what's already available if we would just expand Medicaid. And for far too many, access to affordable, reliable, and continuous health care is quite literally the difference between life and death. We do policy here, but we can only do policy in an effective manner when we keep in front of us the human faces behind the policy we would create, or the consequences for real people when we fail to do what we were sent here to do. And so I want to share the story and remember the life of a Georgian who fought to expand Medicaid, as she and other Georgians lived in the coverage gap. She advocated for herself and others like her. This is Lori Davis. And her husband, Bob, both from Covington, Georgia. Lori was one of our heroes. She spent much of her life serving her neighbors as a trauma nurse in the Grady Memorial Hospital. I've been to that hospital time and time again as a pastor and now as a senator. I've seen firsthand the important work that they do. She was a trauma nurse there at Grady. And while working as a healthcare professional in Georgia, Lori was diagnosed with pelvic adhesive disease. And the chronic pain associated with this condition eventually pushed her to leave the nursing profession. After that, while also working to manage her own chronic condition, Lori struggled to maintain steady employment in the restaurant industry. Healthcare professional, no longer able to serve in her profession as a trauma nurse, working as hard as she can, as hard as she could in the restaurant industry. She believed in working. She understood the dignity of work. But while working, she could not afford health insurance. She made too much to qualify for Medicaid, but not enough to afford other insurance plans. And while in this limbo, Lori had to wait many years for her Social Security disability claim to be adjudicated, and she finally qualified for benefits in 2017. But even then, she was unable to qualify for Medicaid because of her and Bob's combined marital income. And this left Lori in the coverage gap, unable to purchase coverage because it was financially out of reach. Lori went without health insurance for years, relying on her own medical training and free health care clinics to treat her chronic condition. A trauma nurse who had cared for others unable to receive any care. And then in August of 2020, Lori began feeling ill, and her condition got noticeably worse. And fearful of costs, she delayed seeking health care, unable to follow the advice that she no doubt had provided to other patients. Seek health care early. Many things are preventable if you can get there earlier rather than later. She was not able to follow her own advice. And I want us to think about that. She put off seeking the care she needed because she was afraid she would not be able to afford it. As members of this body, we should be ashamed that in the richest nation in the world, a country with all of our resources, with all of our medical technology, that some citizens would choose not to seek treatment even when they know better, because they fear they cannot afford the price tag of life-saving care. That's Lori's story. The next month, in September of 2020, Lori was admitted to the hospital with pneumonia, and while there, she learned, sadly, that she had lung cancer, a treatable condition had she received an earlier diagnosis. And put together, it was too much. On September 17, 2020, Lori passed away. This is the human face of our public policy. These are the tragic casualties of the games that politicians play. As a pastor, I'm praying for Lori's family as they mourn her unspeakable and perhaps unnecessary loss and the legacy she left behind. As a senator who believes that health care is a human right, a sacred obligation, I refuse to stop fighting until Georgians like Lori Davis have access to the care that they need when they need it. Madam President, like Lori, who advocated members of this body for health care during her lifetime, I'm committed to gaining ground in this fight to improve access to health care for Georgians in every corner of the state. She can no longer speak. We must be her voice. She's not the only one. There are millions of hardworking people all across our country who went to school, played by the rules, and they don't have access to life-saving care, costing them their lives and costing us more money. And so we need to pass the Medicaid Saves Lives Act. It's not just the name of a bill, it's actually true. Medicaid saves lives. And until we get this done, I'm going to keep lifting up Lori's story and the stories of others who would benefit from this life-saving legislation. Thank you, Madam President. I yield the floor.